Hi, everyone. Good evening. Welcome to Evoke Therapy Programs broadcast. I am Dr. Brad Reedy. Today is April 16th, 2024. I'm really passionate about tonight's broadcast. I'm going to be talking about finding you, the Evoke Therapy Intensive, all of our intensive work, and really what sets us apart. I know for a lot of you who are regular listeners, I'll oftentimes give the other names of programs, give names of other programs that do the kind of work that we do, and I do that because I don't want people to feel that there's a conflict of interest, that I'm just selling a product, trying to sell something. And I still believe that if that's something somebody needs to do, then doing that is better than not doing it. But tonight, I'm going to be talking about really what sets us apart. Why I always say, even when I give out those other names, my preference, my bias is towards ours. So I'm excited to talk about that and the depth that comes with that. Before I get into it, we always have something where I talk about at the beginning about some kind of commercial, and that's what I'm going to talk about tonight is our finding you options. Our next available workshop, our next available intensive is May 1st through 5th. So it's right around the corner. There are a couple spots available. As I talk to you about it this evening, I'm going to be making this point over and over again that if you really want to help your marriage, if you really want to help your child, in my opinion, the best thing that you can do is go into your own work, and arguably the best way to go into your own work, to springboard into your own work, to accelerate your own work is to an intensive, specifically one like Evokes that focuses on family of origin issues, where you come from, your background, your neurological wiring and training, and how that's playing a part in the challenges that you're having today. So that's the commercial for this. Now I'm going to talk about the product for the rest of the go, specifically theoretically what sets us apart. Recently, I've been getting some questions. They're not new. They're not the first time that I get them, but regular listeners or attendees of these broadcasts will often ask me a question about a child, especially a child where they're experiencing prolonged difficulties after trying a lot of things, a lot of tools, a lot of the things that and the ideas that I talk about. And oftentimes, what they will say at the beginning of their question is, I know you're going to say, and they're right. I know you're going to say that they write that I need to do my own work. And they'll often follow it up with saying, I am doing my own work. I've been in therapy for a long time. So I want to address that idea because that's really at the heart of our intensive work. When I tell parents to do their own work in response to a question with a prolonged challenge in their lives, or a person, just a person with a prolonged challenge in their life, I'm not saying that going to that will give you the formula, the answer that if you employ it, if you embody it, then the problem that's presenting itself to you, like a child who's struggling with mental health or addiction, or a spouse who's not parenting, not carrying their load of the parenting, the emotional workload in parenting, whatever the challenge is. I'm not saying that going and doing your work will give you that formula. I'll talk about that a little bit later. What I'm saying is that you're shifting your focus. The goal of the work is not to get answers specifically in regard to your child. It's not really that. The goal in the work, the outcome of the work is how it changes you and you feel different. And no matter what the tool or the approach is that you consider, it comes from a different place, from a more grounded, less fearful, less anxious, less angry, less exhausted place. I love this quote that reads, "The reward for our work is not what we get, but what we become." And that's kind of what I'm saying. Parent education, parent work, therapy with parents doesn't change children, it changes parents. Now, I will say that this kind of shift away from fear and anxiety, away from anger and frustration, away from resentment and judgment, away from all those feelings that can disrupt or are really evidence of at times of our nervous system dysregulation. It is true that if you get into a more healed place, both in a given moment, but also over a longer period of time, it is true that you have access to your creativity, that you have access to higher levels of thinking, that you're going to respond to your child with a certain kind of energy that is more beneficial for them. All of that is true. But you kind of have to trick yourself. You kind of have to say, you have to come to this realization in this work that, and I talk about this all the time, that If you have a child, for example, that's struggling with addiction or mental illness, that is a problem, but that's not your problem. Your problem is what's going on between your ears, in your body, what's happening for you. So before you even think about doing anything, before you think about any intervention, before you think about any approach to the child, any specific decision, it is critical that you work on healing and operating from a different place. I say this all the time. If you make decisions out of fear, and even, for lack of a better word, good decisions, but you operate from a place of fear, it's really hard to get it right. Conversely, if you're grounded and clear, your nervous system is regulated, and you operate from a place of faith is kind of a word, acceptance, surrender, love, compassion, non-judgment. If you're operating from that more healed place, it's really hard to get it wrong. When I coach people and I look at the transcript of what they might say to their child, for example, a letter that they've written and shared with me, a text that they've written to their child that they're thinking about sending. When I look at that, when I look it over, I'm looking for leakage. I'm looking for issues that are their issues, not their child's issues. It's subtleties, it's things that they say. It's maybe unconscious, but it's at least subconscious, which is just right beneath the level. So remember this. Remember this. The best thing that you can do for the people that you love is to do your work, which means take care of yourself, which means that you are your problem. You're not the problem. You're not your child's problem, but you are your problem. And if you can get to a place of greater peace and serenity and of course clarity, it doesn't really matter what you do because it's coming from that place. And if you need just a little bit more motivation, you will be more creative. You will be more flexible. Folks that study neurology call this response flexibility. When we aren't triggered, when we aren't upregulated, when our nervous system is not dysregulated, we have more flexibility, more creativity. When we're operating from fear, we lose that flexibility. We become more rigid. We try to control things that are outside of our control. And the people around us, the people that we love, the people that we're concerned about, they feel that. And it does not add to their healing. As I've said succinctly in the past and wrote in one of my books, healing from codependency, recovery from codependency, which is just a pop psychology term for having attachment issues. Recovery from codependency doesn't fix anybody else. It only fixes the person who's suffering from the codependency. So I'm going to share with you some theory that supports what I'm describing tonight. It supports how what we know from the literature, from the research to be true, which is the greatest contribution you can make to your child throughout their entire life, the greatest contribution you can make is what is called a secure attachment, to develop a secure attachment, to have a relationship with them that then in their early years is welcoming. You're interested in what's going on inside. You're more interested in how they're feeling and how they're suffering than their symptoms. You're not worried about is if it's not acute or life-threatening in the moment. You're not worried about the fact that they're using, the fact that they're even self-harming. You're concerned about the fact that they're unhappy and that that's the only way that they know how to find relief. So, James Hollis says, if the ambitions of youth, right, if the things that we thought when we were young, if the ambitions of youth, many of which we are able to achieve, truly serve the soul, then we would see a lot more happy people. A big part of the kind of work we do at Evoke is to say, you're going to have to do a lot of unlearning. You're going to have to shed a lot of old ideas. A lot of things that you even take for granted as truths aren't necessarily true. I was just reading a quote by Rene Descartes today, the philosopher, who said, if a person is to pursue a path to become a wise person, they must, as far as possible, as much as possible, learn to doubt everything. James Hollis goes on to say, speaking of this idea that we get to adulthood and we're unhappy. Now, we think we're unhappy because our child is struggling. That's what we think, right? Our child is struggling with self-harm, with school refusal, with addiction, and we think that's the cause of our unhappiness. And of course, if you love somebody who's struggling, you're going to be affected by their struggles. That's to be human and that's not to be erased. But at a very basic, more fundamental level, we are responsible for our own peace of mind. We are responsible for our own serenity. And if we come to the crisis, the real crisis, if we come to it with a dysregulated nervous system, then we're adding to the problem. We're actually adding weight on the shoulders of the person that we're trying to help. Now, not only are they dealing with whatever problem they're dealing with, but now they have to cope with the fact that the person who loves them and cares about them, maybe arguably more than anybody else in the world, if we're talking about a parent, and they experience that fear, that anxiety, that anger, that frustration. They experience all of that is not something's wrong with the parent. They might think that on a conscious level, but unconsciously, the way their body interprets that information is something is wrong with me. So Hollis goes on to explain, but such is the first adulthood, the first half of life, full of blunders, shyness, inhibitions, mistaken assumptions, and always the silent rolling of the tapes of childhood. If one had not set forth and made those mistakes and crashed into those walls, then one would have remained a child. Reviewing one's life from the vantage point of the second half requires understanding and forgiveness of the inevitable crime of unconsciousness. The model that we talk about at Evoke all the time is, and it's not coincidental, that children that the age range of children in our program oftentimes coincides with a parent's midlife. And so when not only your child's struggling, but when your emotional consternation and misery is also being experienced because of their struggle, this is a time to recalibrate life, to look at your life, to unlearn. James Hollis says to realize that you've accepted the wrong answers for life's most important questions. And that your chief obstacle is not the child, he explains, but your chief obstacle is who you have become up to this point. I shared recently, my wife and I were talking about a new case that she was working on. She's a therapist also. And we were playfully talking about our own journey and what we've learned and what we're still learning and how humbling this process is and being a parent to 4 children over many, many years. And I said, it's hard. It's hard to talk to parents that are new to this work. Because if you were to tell them the truth, you would say most things that you've been taught, most things you believe about love, about relationships, and about parenting are in large part not true. You're gonna have to relearn life. I love what the Sadhguru says, what Sadhguru says about this. He says, when we have children, it is time not to teach children about life, but to relearn life. And to realize we are the student and they are the teacher. And in a spiritual, philosophical sense, they have come to wake us up. They are exposing our emotional immaturity. They are exposing the parts of ourselves that we have been avoiding our whole life. That is the call. That is the invitation. And I can say that with kindness and love because it's true for me. That's what has happened to me and is still happening to me. I am still growing as a parent after all these years. And I hope and expect that I'll continue to grow. I share this quote often. It's one of my favorite quotes. It's from a man by the name of Stephen Mitchell, Dr. Stephen Mitchell, who wrote a book called about psychoanalysis. And I quoted it in The Journey of the Heroic Parent when I was setting forth in the introduction, kind of my model and what I was going to be talking about. And this is what he wrote. He said, the emphasis is not on behaviors, meaning as a therapist, it's not on what you do. And this is true for parents. It's not on what you do. And that is the dominant question people ask me in therapy every day. What should I do? The emphasis, he says, is not on behaviors, but on rigorous thinking. Not on constraints, but on self-reflective emotional involvement. Not on the application of general truths, but on imaginative participation. This suggests a very different sort of technique. The discipline is not in the procedures, not in the skills, not in the tools, but in the sensibility through which the analyst or the therapist or the parent participates. There is no generic solution or technique. There is a great deal of disciplined thought in the skilled practice of clinical psychoanalysis and continual complex choices. So, why is this quote so important to me? Because anytime a theory or a technique becomes the thing, you lose contact to some degree with the client or with the child. You lose flexibility. I see it all the time with therapists that I'm teaching and training all over the country. They get so enamored with their technique or their model, whether it's IFS or psychodrama. We use psychodrama at our program, whether it's CBT or DBT. They get so enamored with this, and understandably so. It's terrifying to walk into a room with a client with the urge and the ethic and the hope that you can just be helpful. So when someone gives you this elegant theory that seems to answer all the questions, all the forks in the road are made clear by this technique, you grab onto it for dear life. But as you grow and age and stay open and continue to doubt and even try things and learn how they fail, how the technique doesn't do it. The technique is, of course, can be helpful in a broader context, but it's not the thing that changes people. Like Jung said, it's soul to soul, right? It's person to person, heart to heart. Master all the theories and techniques, but in the end, just be one human soul touching another human soul. And this is true of parenting. It asks so much surrender. It asks to let go so much. And the principle, this is important. If you didn't grow up with a secure attachment, or I should rather say, to the extent that you didn't grow up with a secure attachment, with a parent who understood what it meant to be this way, to be a safe person, to be there, to be curious about what was going on inside of you instead of what you were doing, to not focus on you doing well or right or good, but to just to be concerned about the state of your being, right? That they themselves didn't act out of fear and anger and frustration and judgment. To the extent that you didn't get that, you were then left alone in your trauma. Even if you didn't have a big T trauma, you were left alone to some degree. If you had a parent that understands what I'm describing, then when you lost a pet, when somebody made fun of you at school, when a teacher um, called you out, whatever the trauma was, big or small, if you had a parent that was providing secure attachment, they would sit with you in your tears, in your fear, in your sadness. They would come to you with a regulated nervous system themselves, and that's what they would offer you is the presence of somebody where you could co-regulate. That's the idea. But to the extent that that didn't happen, you then fall into the pattern that human beings fall into, which is because you can't feel safe in crisis, in challenge, you think that the answer is to prevent bad things from happening. And if you are insightful and intelligent and creative and motivated, you have a lot of success at controlling your environment. You know how to speak to people because you grew up with parents who were anxious or depressed or alcoholic. So now you know how to deal with those kinds of people. And you're really good at it and you become a therapist because of it, right? You learn how to manage the world. But codependency is that definition. It's trying to control things outside of me to manage an internal state, an internal emotion. Conversely, recovery or healing from codependency, or somebody who has a secure attachment, a strong sense of self, doesn't try to control other people, which, by the way, makes them more influential. They don't try to control other people. They just learn to tolerate and feel what is. I love the quote. I've been thinking about it all day as I was writing these slides that says, if we don't become the ocean, it's an Eastern philosophy. If we don't become the ocean, we'll be seasick every day. You have to learn to deal with things outside of your control. And as parents, when we see struggling children, and to the extent that we don't have this history of a secure attachment, we try to control the child. We think the child is the cause of our distress. We don't know that the cause of our distress is kind of faulty neurology, faulty nervous system regulation. And that makes all the sense in the world. Another reason why techniques themselves don't work or advice doesn't work is because situations are fluid and changing all the time. Carl Jung says we cannot live the afternoon of life according to the program of life's morning. For what was great in the morning will be little at evening, and what in the morning was true will at evening have become a lie. I was doing the all-day parent workshop on Friday of last week, and somebody asked, and they asked for permission if it wasn't too much off topic to talk about marriage and how some of the things we were talking about applied to marriage. And I said, I love to talk about it with art. I love to talk about it with sports. I love to talk about it in so many different contexts because what that practice is saying the principles are true in all of it. If you get nervous playing tennis, you lose your accuracy. You lose your power. If you can relax playing tennis, I was given the book, The Inner Game of Tennis, when I was a teenager because I played tennis. And it teaches the same thing. If you learn to let go, to trust your swing, to trust your practice, ironically, if you learn to let go of where you're aiming the ball, you have more power and more control. So when we internalize these principles, they start to play into everything that happens. A big difference at Evoke also is we are a clinically based program. And what that means is it's not sterile or hospital like. It means that our therapists are trained at a higher level. Yes, they learn the tools and the skills of psychodrama, of other action experiential based therapies for sure. Art therapy, music therapy, other kinds of things. They know about DBT, CBT, they know about all those things. But what I'm talking about is they understand how transference and countertransference play into the equation. Transference is how the client feels towards the therapist. Countertransference is how the therapist feels towards the client. And of course, they mix and match. Jamie Gill, in the foreword of The Audacity to Be You, wrote it this way. She said, what does a well-trained therapist look like? A well-trained therapist is an expert at listening. He or she wants to hear how you feel, not how you are supposed to feel. He or she will try to find you where you are. He or she will try to find how it feels to be you with your history, your dilemmas, your hopes and fears. If instead of trying to hear and find you, your therapist has the right answer for you, find another therapist. The right answer, she says, will always be the therapist's answer and not your answer. And this will likely duplicate the ways you were treated by your parents. This quote is so profound and important. Because we all want to be told what we should or shouldn't do, the right thing to do, the best thing to do. And because therapists who aren't trained in the model that I'm describing and understanding transference and countertransference, really understanding what the basis of therapy is, they'll be tempted to answer those. And they've developed, like I said, they've developed these elegant answers. I spent 15 years of my career in my young years as a therapist giving people elegant answers about what they should and shouldn't do in specific situations. But the well-trained therapist doesn't do that. The well-trained therapist says, I don't know what you should do. Here's the stuff that I see that's in the equation to work on. You have to change the question. Because the question of what should I do, it doesn't make sense. It's not a technique. It doesn't make sense. The idea is to learn to become a person, right? This is the story of Pinocchio. This is the story of the Barbie movie that just came out. This is all the stories, is to become a person, to become who you are. James Hollis says, to become a person does not necessarily mean to be well-adjusted, well-adapted, approved of by others. It means to become who you are. We are meant to become more eccentric, more peculiar, more odd. We are not meant to just fit in. We are here to be different. We are here to be the individual. Not only does this have implications for you, But think about this has implications for our children. So much of what happens in adolescence is them saying, "It's my life." And it's so important for me to establish that feeling in my body that it's my life, that I'm actually willing to put my life at risk to prove to you that you can't stop me from hurting myself through the restriction of food, through suicidal gestures, through substance use, through dangerous activities, through what that is the primary task of the adolescent is to separate. And because as parents, we've been told that our job is to advise and kind of shape our children up, we don't know how to react. We don't know how to interact with them in a way that makes sense. Because we either think that we're being neglectful and under-parenting, or we think that we're doing the right thing by trying to control things, but we're experiencing failure after failure after failure in our attempt. The Evoke's difference is that we were founded by clinicians who are steeped in attachment theory and a working knowledge of complex trauma. Complex trauma is just the soup you were cooked in. It's the way that your family was. It's all the little things. How does your family deal with anger? How does your family deal with fear? How does your family deal with love? How does your family deal with relationship? How does your family deal with failure? How do they deal with success? What happens when a child acts out? How does a parent think about that? That's the complex trauma. It's the way that they are with each other. Sometimes it's referred to as attachment trauma, process trauma, or small t trauma. It's not the big events over which many we have very little to no control over. It's what happens after the big T trauma happens. If you find out that your daughter or your son gets sexually assaulted, you didn't have control over that. They were in school. It was a somebody at church or a scout leader, whatever it was. It was on a date, whatever happened. You don't have control over that. But how you deal with it, that will be the predicting factor of the development of mental health or mental illness. And you have to come at it with a regulated nervous system. You have to sort out your issues. You have to find healing and ground in this so that when you're there with a child, you can be helpful to meet their needs, which at times to the novice in this work are going to seem invisible and strange and odd. It's going to feel like under responding. So our therapists are trained and we come from that clinical model. This is not something that came from the recovery community. This is not came from the research in codependency. This is came from the folks who talk about how Homo sapiens are, how they develop genetically, how they develop in the context of a specific family and a specific culture in a specific period of time, and how that impacts them. The family systems people who started in the 1960s observed this and noticed that it wasn't that dad lost his job. It wasn't that mom got cancer. They predicted whether or not the family would fall into dysfunction. It was how they dealt with it. And so they realized that we have to help people understand and look at things differently. And that's what happens at Evoke. That's what happens through this process. We don't give you your we don't give you the answers to your life. We ask different questions. We bear witness. We tell you what we see. We help you make connections from the way that you related to your father and the way that you're relating to your daughter. And what kind of work is involved in transforming that. All of our intensives have two staffs, two therapists, either a therapist and a co-therapist, or a therapist and an assistant therapist. Why is this important? Because sometimes we lose ourselves as therapists. Sometimes we make mistakes. Sometimes we get caught in countertransference. Sometimes we want to be so helpful that we start giving answers. So on our breaks, and we take them all day long, we give feedback to each other. We ask questions. What are you doing? Why didn't you do this? Why did you do it that way? It's really important and really valuable. An Evoke difference is we meet you where you're at. And that means that you don't have to come trusting us. You don't have to come open. You don't have to come subscribing to our philosophy, surrendering. You don't have to be a good client. You get to come where you're at and we meet you there. See, that other way, when you are told to trust the process, That other way is how our parents were. We were just supposed to trust them because they were the authority figures and the adults. And I always say if somebody comes distrusting of the process, they have a really good reason for that. And so instead of trying to get them to trust the process, I want to get curious about why they don't trust. That will give me all the answers and subsequently them all the answers they need to unravel their complex trauma. And again, we do use psychodrama as a big part of our approach. That's role playing, action-oriented therapy. We do use a lot of psychodrama, but we are not a psychodrama program. I've had people try to sell us trainings on psychodrama. I have therapists that go and do psychodrama trainings, but they come back a little bit too in love with the technique. And they realize that you have to drop the technique sometimes. You have to break the rules. And what are you teaching when you break the rules and drop the technique? You're teaching response flexibility. You're teaching the client that they are more important than your love for the technique. Like I said, you have to understand transference and countertransference, and that's all we talk about at Evoke. That's what our supervision looks like. That's what our trainings look like. And how will that make a difference in your work? Let me read this to you, a quote that I came up with while I was doing some supervision with my daughter, Emma, a couple of years ago. She said some version of this, and we talked about it. She said, defensiveness doesn't feel like defensiveness to the one exhibiting it. Defensiveness feels to the person exhibiting it, it feels like they don't understand me. They don't see the whole picture. So the task for the therapist is to understand the other, not fix the other, not shape them up, not improve them, but to understand them. This condition becomes the this compassion becomes the precondition, and arguably it becomes the treatment. I wrote as a caption to this social media post, whether raising children, doing therapy, or supporting a partner's journey, the precondition for the development of the authentic self is compassion. You're mad at the fact that you make the same mistakes, that you yell at your spouse or your child, that you're self-medicating with food or whatever it is. You're mad at yourself. You've been taught to be mad at the symptoms your whole life. Your parents were mad at the symptoms. They were scared by them, that you were taught to be mad at them. So that's what you know. And it's terrifying. It is terrifying to shift gears and to start to love the symptom, to thank the symptom, to understand that the symptom is there giving you a message, trying to protect you. Many have suggested that the hardest work we do is to become who we are. Creating a safe place for someone to explore and unearth themselves is the greatest gift we can offer those that we love and serve. This feeling of not being seen by a therapist, by the way, what I described as the defense, this feeling of not being seen is also the same feeling you have when somebody doesn't see you. In that case, it's not a defense. So when you're a therapist and you offer an idea, a concept, an intervention to a client, and it doesn't take, it might be the wrong intervention. In fact, my daughter says one of her professors says it's always the wrong intervention if the client isn't ready for it. And I agree in large part. It can mean that they aren't ready. It could mean that it doesn't apply. It could mean that you don't understand them. This feeling of not being seen is also the case when the therapist, in fact, does not see you. And that's the great challenge. And that's why it's disciplined thinking. That's what clinical training is about. Safety in a large way is the treatment. It's more than just a precondition. It is the treatment. Our process at Evoke, sometimes people in our field will call things intensives, and there's a lot of psychoeducation. Let me be clear that this is group therapy. This is this is therapy. And that can be intimidating. We've even thought about changing the name away from intensives and calling it workshops or something else. But it's therapy and it's safe. You get to be the gatekeeper. You don't have to go any deeper and faster than you want. I've had the most success when I have been able to slow down to the client's pace of things, to the client's level of trust and feeling of safety. And what they will say to me inevitably when I allow for things that other therapists don't because it's not the right thing to do, what I've been told over and over again is nobody else saw me that way. Nobody else gave me that wide berth. They always told me that the reason I didn't do this or didn't want to do that, and they would judge me as being defensive or resistant. We don't do that because that's not therapy. That's what a layperson thinks. A layperson sees a problem, sees a concern, sees a dilemma, and tries to fix it. A therapist sees it and tries to encourage a healing process. There is psychoeducation, but that's not the primary energy, the primary thrust of the Evoke Intensive process. Evoke is not tied to a religion or even to the idea of having a higher power. Because we're not based in the recovery, we don't come largely from the recovery world, we don't have that ethic. We don't talk about God or a higher power unless you do. It's not our model. While Evoke does value the process of recovery and the 12 steps, and you know this because at the end of every broadcast, I encourage everybody to go to 12 steps. Everybody. While we do value recovery in 12 steps, Evoke bases his work on attachment theory, psychodynamic theory, which is understanding child development and how one can interact with a child and an adult in a way to heal, and also family systems theory. Evoke does use psychodrama, action-oriented experiential therapy, but we are principally an attachment-based approach. And ultimately, the client isn't given answers to their question, but learns to find their own answers. And maybe more importantly, what's in the way of the ongoing project of becoming who they are, becoming their authentic self. That's the work. The work is to become who you are. The defense is the protection that you put up against who you are because who you are wasn't acceptable. So to get rid of the defense, you've got to feel safe. Doesn't that make sense? And how can you feel safe when the therapist is looking down on you from their throne and telling you what's what? I love the couple of quotes about transference and countertransference. It's important to understand the distinction between personal countertransference, which has to do with the therapist, and a diagnostic response that indicates something about the patient, the client. This is called diagnostic countertransference. A new belief had come into being that countertransference can be such of enormous value and usefulness in the clinical practice. You have to distinguish between what your reactions to the patient are, telling you about his psychology, and what they are expressing about your own. That's why the two therapists help. That's why the approach works. I was recently, I've been in a setting where I've shared with a therapist that sometimes when I'm in the role of the therapist, I always feel like I have to pull a rabbit out of a hat, wrap everything up in a bow. And some time ago, I shared this thought with a therapist I was meeting with. And they said very confidently that they never have that feeling. And so I was glad to hear that. I was glad they could acknowledge their privilege in not having that deficit that I have sometimes. And then over the course of several weeks, all they tried to do was pull a rabbit out of a hat and wrap everything up in a bow. And eventually, through our interactions, they came to see that that's what they were doing. But that's how subtle this stuff is. You know you have a good therapist when they can talk about themselves to some degree, about their fallibility, about their own idiocy. They don't give you an energy, look, I've arrived. This is the way that it is. I've learned how to have a happy, successful life. Just follow my lead. They say, I'm a little bit farther along on this healing process. I can only take you as far as I've come. So let's walk together for a while. And the goal of our intensives and the goal of psychotherapy, I teach this to our therapists in all of our programs. The goal is that the client wants more. The client wants to come back. And the reason why that is so critical and important is because transformation takes a long time. As I have said, the greatest obstacle for psychotherapy and its effect is the pace of things. It's slow. There are wonderful epiphanies, insights, and aha moments along the way. But the fact of the matter, it's a lifelong journey. It's your life's work. More about transference and countertransference and the clinical approach. Freud initially encountered transference in his therapy with patients. He felt it was an obstacle. That's the way it was thought of at first. But what he learned was that the analysis of the transference was actually the work that needed to be done. So when somebody says to me, what should I do? That's transference. They think that I'm a higher power, their parent. an expert on them. That's the transference. So when somebody comes in, when somebody is afraid to disclose something, see, I'm learning from them how they see me. I'm learning what they've transferred onto me. I used to say to the students, to the young men that I worked with, I'm not a police officer. I'm not a probation officer. I'm not a priest or a rabbi. I'm a therapist. I'm not a parent to you. I'm a therapist. And that's something qualitatively different. Countertransference is defined as the redirection of a psychotherapist's feelings towards a client, or more generally, as the therapist's emotional entanglement with the client. You get involved. I love this quote. This next quote. If the therapist does not get emotionally involved sooner or later in a manner that he had not intended, therapy will not proceed to a successful conclusion. So sometimes you get caught. Sometimes you're I have to say to people all the time, "Hey, I'm sorry. Our last session or our last hour, whatever it is, I was trying to take away your pain, and that's unfair of me. It comes from my own stuff. It's hard for me to watch you suffer, and I apologize. So can we go back?" Usually people will say, "I didn't feel that," or whatever, but it happened. And it might not have been conscious for them, but it became conscious for me. The contemporary understanding of countertransference, that is, how the therapist feels about the client, is thus generally to regard countertransference as something that is created jointly. It's a phenomenon between the treater and the patient. The patient pressures the treater through transference into playing a role congruent with the patient's internal world, with their past, and the roles of other people in their life. However, the specific dimension of that role are colored by the treater's own personality. So when you come to me and say, "What should I do?" Based on my background, I'll respond differently. Jamie Gill goes on to explain in the forward of The Audacity to Be You. None of this is the case. A well trained therapist is a person who is skilled at creating an environment that is safe and in which one can feel welcome. That is, the therapist is not like one's parents. The therapist listens. He or she doesn't simply dispense answers. On the other hand, he or she will help us find our own answers and supports them. When we are seen in a different light by somebody seeking to understand us, we are able to find ourselves in a different world from the one many of us have known. It's what was missing in our childhood. That's the difference out of Evoke Intensives. It's a sacred, safe place where you get to be seen and heard, and we get to be witnesses to your history. And we get to be witnesses and we reflect back how we see your history impacting the relationship with your child who's struggling with mental illness, or with your partner in a marriage difficulty. Like I said, safety in this way is not the precondition of good therapy. Safety is the therapy. When we are seen, heard, understood, and found, we find ourselves. This is the way. The therapist, Jamie Gill wrote, "The therapist or guide we choose." I love this quote. It's dramatic, but I love it. "The therapist or guide we choose must not duplicate the wounds of the past. Thus, if the therapist or guide knows what is right for us and manipulates us to achieve these treatment goals, it is abuse, plain and simple. It is hard to see how good abuse ever cures bad abuse. It's the difference between giving somebody a fish or teaching them how to fish. We believe that going back into one's childhood holds in it the answers for the problems that we're facing today. And there are some therapists, not very many that I've worked with, but I've heard stories of them where they say, don't go backwards, just go forward. That would be nice if that worked. I've never had the experience as a treating professional for that to work, nor have I had that experience as a person in this world. And my favorite quote of The Drama of the Gifted Child, which is in attachment research, it is supported by the most modern research. Alice Miller states, "Experience has taught us that we have only one enduring weapon in our struggle against mental illness: the emotional discovery of the truth about the unique history of our childhood." We have to go back and see how we were programmed. James Hollis says the truth about intimate relationships is that they can never be any better than the relationship we have with ourselves. So that's why it's finding you. That's why I virtually encourage everybody who has a struggling child, somebody they're concerned about that they love, a marriage that's in difficulty, start with finding you. Start with knowing yourself. Start with finding out how you are inadvertently, unconsciously contributing to the dynamics that you want to see stop. Somebody that worked at the University of Utah Department of Psychiatry years ago told me that when they sit in a room full of doctors in a boardroom, what's largely driving the issues is the unconscious material of all the people around the table. It's not, these are all really smart people, people who are very motivated to affect change in the world. But the unconscious, unhealed, unexplored parts of themselves are constantly getting in the way. Like the Oracle of Delphi says in the first edict, know thyself. From the Knight in Rusty Armor, a book that is our standard book for our clients in wilderness therapy, about a knight who wants to take off his armor because it's getting in the way. His defense, in other words, is getting in the way of his connection to his wife and to his child. So he goes to look for Merlin. The magician finds him, and Merlin becomes his guide through this journey. And he was told by Merlin that he could call him along the way in his journey at any time. And this is an excerpt from the book. The knight looked toward the sky and with a booming voice said, Merlin, I must talk to you. As he had promised, the magician appeared immediately. He was bare except for his long beard, and he was dripping wet. Apparently, the knight had caught Merlin taking a bath. Sorry about the intrusion, said the knight, but this is an emergency. It's all right, said Merlin, interrupting. Magicians are often inconvenienced. He shook the water from his beard. To answer your question, it is true. You were in the Castle of Silence for a very long time. Merlin never failed to astound the knight. How could you know what I wanted to ask you that? He said, can you read minds? And Merlin laughed and said, no, but since I know myself, I can know you. We're all part of each other. The one difference between Evoke Therapy programs is that we know that we can only take you as far as we've gone. We can only meet you as deep as our consciousness allows us to. That our personal work is the greatest predictor of our capacity to help you. That is why it is a core value in our company that everybody does their own work. Doesn't matter how much you read, how much you study, how skilled you are, how theoretically adept you are, you have to do your own work. It's possible, I wrote in The Audacity to Be You, it's possible to look to our past, to look to our wounds without falling into a victim's mindset. That's one of those worries that people have. It's not a search for blame, but rather a search for understanding and self-compassion. Our aversion at looking to our past, to our parents, may be that we are still trying to protect them. We are carrying around our parents' defenses. We do an experiential program because it's whole body, right? It brings up unconscious and pre-verbal energy, feelings. You will walk into finding you. You will think you've got a handle. You'll be nervous because you won't know what it's like. And you'll start to participate in the work and you'll realize that you have feelings stored in your body that you didn't even know about. And because of the way that we set up the environment, you'll also feel safer to explore those than you have felt anywhere. At the beginning, you'll be nervous to join us. And at the end, you'll be scared to leave us. Because you've never felt such overwhelming compassion and non-judgment and safety. Not just from the therapist, but from the way that we facilitate the group. And that's why the relationship with the therapist is so important, because we have to be different. We have to be different. And different isn't meaning that we study and have letters after our name and have been certified in a certain theory. We have to think differently. We have to feel differently. We have to react differently. And that comes from our own healing, our own development. You come into contact with your younger self in this work when you go back, when you explore your childhood, and you understand what traumas, what unhealed messages, what ideas are still fueling your behavior. Like I said, like James Hollis said, every relationship we have mirrors or comes out of the relationship we have with ourselves. We have to realize that there's something unconscious in this work. And you need some help to discover that. We don't just treat the conscious mind. That's psychoeducation. That's advice. That's cognitive behavioral therapy. That's a lot of things that have their value. Those things aren't useless. But this work is deeper. And if you're afraid, if what I'm saying to you intimidates you, now you know how the identified patient feels. Now you know how your child feels, the one that you sent to a program, or your alcoholic spouse that you asked to go to treatment or go to one of our intensives. Now you know how hard this is. And now you have more empathy for what you're asking them to do. Knowing and sitting with yourself, learning to walk past the sentinels, the guards of shame and guilt, of should and shouldn't. That's what we do. We have to get out of the world of should and shouldn't. We have to get out of the world of guilt and shame. Those things are not helping us. Once in a while, they encourage some pro-social behavior for sure, but they are completely unreliable energies, and they cause us to be afraid, to follow the rules, even the ones that don't make sense, to do what we were taught. Many ideas of which have worn out their usefulness, or were never useful in the first place. Sometimes you just need to hear yourself say it. Bessel van der Kolk, the author of The Body Keeps the Score, said, "Traumatized people chronically feel unsafe in their bodies. The past is alive in a form of gnawing interior discomfort. Their bodies are constantly bombarded by visceral warning signs. And in an attempt to control these processes, they often become expert at ignoring their gut feelings and numbing awareness. And in numbing awareness of what is played on the outside, they learn to hide from themselves." That's deep work. This is going to be a two-parter because I can talk about the couples intensives and the family intensives, but it's really all the same thing. And really, this our program came out of me doing my own work. And this is from the Journey of the Heroic Parent, the introduction to the Journey of the Heroic Parent, where I went in and participated in a similar type of program. And this is what I wrote. This is where I'll conclude for tonight. As we sat together, we came to know each other and ourselves better than we had the 6 days before. Not everything was healed or resolved, but we were able to recognize the origins of our issues. This self-knowledge offered us the ability to forgive ourselves. Of course, you put a lot of weight on what others think of you, they told me after we had acted out some role plays in my early years. That is how you survived childhood. Along with forgiveness came the invitation to move on. That old context is over, they told me. You don't have to sacrifice yourself and your needs anymore so that your single mother struggling with depression will be okay. You can still be loved if you take care of yourself. Near the end, on the final day, as each member presented his or her question, we weren't allowed to talk about our current dilemma, the thing that brought us there, until the very end. The group leader set up a quick staging for the role play. The first group member started with the question, "How do I deal with my alcoholic husband?" From there, the group leader encouraged her to answer questions like, "How do you feel? What do you want?" Then the group member was encouraged to find their truth and speak it regardless of the reaction from the other character being portrayed in the role play. As it drew closer to my turn, it dawned on me that I already knew what I needed to do and that the answer had been there all along. I had been hiding the answer behind the needs, wants, and expectations of others because I had learned when I was young that this is what I had to do in order to survive. This self exploration during my week at the seminar made its impact crystal clear. The question is not the question. The question is not, what should I do? I know it seems like it, but this is not a doing thing, this mental health project. This is becoming something more authentic, more honest. I thought I was confused, and I wasn't confused. I was afraid. And I left there with the profound realization and responsibility that I had to figure out who I was at any given moment. I had to work toward that all the time and tell the truth about that to the people that mattered to me. The real question I wrote was, who am I? And what do I want? Through this process, I found myself. The root of the self is almost always found through another person. When someone else finds us, we come to find ourselves. So like I said, this is a two-parter. I didn't plan on being a two-parter, but it will be a two-parter. and I'll talk about our custom intensives. In fact, I'll talk about it next week when I do this. I'll push the Q&A back. I'm just going to end with these highlights. We have smaller, more intimate groups. We have more clinical training. We're not imposing a specific idea or curriculum on the client. It is deep work, a springboard into your work or an accelerator of the work that you're already doing. It's a flexible approach, meeting the client where you are at. And the clinical expertise of our process leads to the client feeling safer, seen, and supported. And since the pace of therapy is the biggest obstacle, the intensive amount of time that you spend in it takes away the urge for the therapist to fix things up really quickly. We're able to take our time and help you come to your own conclusions. All right, folks, I'm going to wrap it up for tonight, but we'll do part 2 next week. The Journey of the Heroic Parent and the Audacity to Be You are available on Amazon and Audible. Our next Finding You Intensive in person is May 1st through 5th. Like I mentioned, May 17th through 19th is an online version. We also have custom Finding Connection intensives for couples and co-parents, and also Finding Family for families. Contact intensives at evoketherapy.com, use the QR code, or go to our website. We have support groups for our alumni and current families of our wellness program. April 18th, that's Thursday, at 7 p.m. Mountain Time is that next offering. Once a month, we have an alumni parent-only meeting for people that are farther along on the journey. May 20th at 6 p.m. Mountain Time is that offering. And then for our intensives and coaching clients, current and alumni, we have one meeting per month, a support group. May 13th at 6 p.m. Mountain Time is that offering. Email us at supportgroups@evoketherapy.com. Use the QR code or go to our website. We have coaches that can work with you virtually who are trained in this model, who understand what I'm talking about. So they can work with you as your child is coming home. They can work with you if you're dealing with anxiety, depression, if you're dealing with getting unstuck, marriage, stage of life, whatever it might be. We ask all current clients to just try Al-Anon, CODA, Families Anonymous, or adultchildren.org. Any combination of those 12-step support groups. Just try 6 of them. You can also use refugerecovery.org or the National Alliance on Mental Illness. All of these broadcasts are available on your favorite podcast app. Just search Finding You on Evoke Therapy Podcast and like us and subscribe there, and notifications will come each time a new episode is released. You can also go to soundcloud.com on your computer and search for Finding You there, or you can go to Evoke's YouTube channel and watch the video rebroadcast of these episodes with the slides and the quotes. You can find Evoke Therapy programs and me, Dr. Brad Reedy, on X, Threads, and Instagram using the handles @Evoke Therapy and @Dr. Brad Reedy, respectively. And you can find Evoke Therapy Intensives on Instagram using the handle @Evoke Therapy Intensives. On Facebook, you can find us by searching Evoke Therapy Programs or Evoke Therapy Intensives. And of course, our blog has wonderful content each week. All right, folks, this schedule that I've listed here is going to change. Next week, I'm not doing another one this week. Next week on April 23rd, a week from tonight, I'll be talking about part 2 of Evoke Intensive, specifically about finding connection for co-parents and couples, and also for finding families. So I look forward to that. So we'll push everything back. You can always reach out to us, ask for copies of slides, ask questions. Those will go to the top of the queue of the next Q&A. You can also make suggestions for new broadcasts, new topics. I love when that happens. And if you want copies of slides, email us at webinar@evoketherapy.com. That is all things Evoke Therapy podcast, broadcast, and webinar@evoketherapy.com. We're happy to send you copies of the slides so you don't have to frantically take notes during this or take pictures if you're watching the live broadcast. All right, folks. Thanks for joining me. I hope this is a helpful point of contact. And for and on behalf of the people that you love and the people that love you, thanks for showing up and being willing to do your work. It makes all the difference in the world. Have a great evening. I'll talk to you next time. Bye-bye.